Hello, everyone. My name is Christina, and today I will be discussing Marfan syndrome. What is Marfan syndrome? Marfan syndrome is a genetic disorder that affects connective tissue. Connective tissue connects, supports, and helps bind other tissues. Numerous imperative body functions rely on connective tissue, such as supporting organs, storing fat, and repairing damaged tissue. Marfan syndrome basically affects these tissues by altering the protein that is responsible for making healthy connective tissue. If connective tissue is not healthy, it can affect how the body grows and functions. People who have Marfan syndrome can have a range of symptoms, and each symptom can vary in severity. While this condition is considered rare, modern technology has allowed people who have this disorder to reach out to one another. One of the consequences of these interactions is that people who suffer from Marfan syndrome like to call themselves Marflings. My boyfriend is a Marfling, and some of his symptoms are common, but some of his symptoms are not as severe as some others. Some of the most common symptoms include long limbs, particularly fingers and legs, a very tall and lean body type. Marflings tend to be very thin. Scoliosis or a curved spine, the chest sinks in or protrudes outwards. Flexibility, mysterious stretch marks when a person has no history of gaining weight or losing it. Teeth crowding, and eye issues. These symptoms can be seen visually, and doctors who are familiar with Marfan syndrome can usually tell if somebody has it or not based it on the person's physical structure and capabilities. There are more severe and serious symptoms of Marfan syndrome that can also vary in severity. These are also harder to detect and may require further testing. These include heart issues, especially ones related to the aorta, and eye problems, usually in the form of nearsightedness, cataracts, detached retinas, and early glaucoma. Because these symptoms are harder to detect, they require further testing, which will be discussed a bit later on. Like most medical conditions, Marfan syndrome is named after someone who contributed to preliminary research on this condition. Antoine Marfan was a French doctor and professor who, in 1896, was puzzled and fascinated by a 5-year-old patient of his who presented some of the symptoms noted in the last few slides. Although today, due to modern science, it is thought that his young patient actually suffered from another similar medical condition, his research led to more awareness of Marfan syndrome. There is much debate about people who may have Marfan syndrome before medicine allowed for a proper diagnosis, but it is thought that Abraham Lincoln had Marfan syndrome due to his tall and willowy stature. Some other people who may have had Marfan syndrome include Julius Caesar, Peter Mayhew, who played Chewbacca, Joey Ramone, and King Tut. Now for the science behind it. What actually causes Marfan syndrome? Marfan syndrome is caused by a mutation in the FBN1 gene. As mentioned before, this mutation hinders the body's ability to create the proteins needed in order for healthy tissue to grow and function. The FBN1 gene is responsible for making the protein fibrillin 1. Fibrillin 1 binds to other fibrillin 1 proteins to form microfibrils. Microfibrils are essentially thread-like structures that help bind and attach to other microfibrils. These microfibrils intertwine with connective tissue. Microfibrils also aid in the growth and repair of tissues and organs throughout the body. A genetic mutation in the FBN1 gene results in a decreased amount of fibrillin 1 proteins that are created. In turn, this also leads to a decrease in the number of microfibrils that are produced as well. Microfibrils then cannot bind to growth factors that are responsible for the maintenance and growth of tissue and organs. This means that excess growth factors lead to unhealthy and elastic-like tissue, which is Marfan syndrome. Because this condition affects many tissues and organs, the ocular system, skeletal system, and cardiovascular systems are usually the most affected. Marfan syndrome is an autosomal dominant condition, which means that if someone has just one parent who has the condition, they have a 50% chance of inheriting this disorder. Inheriting this condition is not dependent on gender. So if a mother or father has this condition, the chance of their offspring, regardless if male or female, still has a 50% chance of inheriting it. There is a chance that someone can have this condition even if they do not inherit it. This is called spontaneous mutation, and it is estimated that about 25% of people diagnosed with Marfan syndrome do not inherit it. This occurs in about 1 in 2,000 births. It's hard to get exact numbers of prevalence for Marfan syndrome, as there are many people in the world who have not been officially diagnosed. This disorder does not seem to target one gender over another. Both are affected equally. There does not seem to be a specific country or region in the world where there is a heavier presence of Marflings than other places. There is also no evidence that suggests one race is affected more than others. It is a bit of a rare disorder. It is estimated that 1 out of 5 to 10,000 people have Marfan syndrome. The age someone is diagnosed varies, anywhere from young children to teens and adults. A lot of it depends on the severity of symptoms. First, a doctor will look at family history and see if there is any way that this was inherited. This is also usually accompanied by a physical examination, where physical traits like finger length and spine curvature are examined. My boyfriend was diagnosed at 14, and it was because he was showing off how flexible he was to the doctor. The doctor told his mother that he should not be that flexible at his age, and therefore was referred to a Marfan specialist. If someone is suspected to have Marfan syndrome, they also undergo more in-depth tests for a diagnosis. Marfan syndrome has the potential to be fatal or debilitating, depending on how it affects organs. Some other tests include echocardiograms. This is a test that can show detailed images of someone's heart and can help determine how well blood is being pumped throughout the body, as well as to see how healthy the aorta is. This can give doctors a good idea of how much this disorder is affecting the heart. An electrocardiogram, or EKG. This records the heart's electrical activities through cycles. This is done by placing patches or electrodes on someone's skin in certain areas and can help detect heart arrhythmias. Eye examinations. Frequently, Marflings suffer from rather poor eyesight. Eye issues like cataracts, which is clouding of the lenses, detached retinas, where the retina at the back of the eye pulls away from a layer of blood vessels that supply oxygen and nutrients, and glaucoma, which is eye disease caused by damage to the optic nerve and can lead to loss of vision, are all common with people who suffer from Marfan syndrome. Depending on the severity of the condition, there are several things that can be done while living with Marfan syndrome. In less severe cases, people who have a more mild case of Marfan syndrome are not as limited as you would think. Heavy cardio and heavy physical activity is not something he can participate in, as it strains the heart and can lead to heart attacks. Most children and teens diagnosed with Marfan syndrome are barred from participating in any sports or PE in school. Contact sports are also prohibited, as bones can be fragile and the heart can also be affected by direct hits to the chest. People with Marfan syndrome also undergo frequent physical examinations, a few times a year, to ensure that tissues and ligaments are not deteriorating. Getting an echocardiogram at least once or twice a year is also common, so the heart can be monitored for any changes. Blood pressure medications are also frequently administered to lower blood pressure or heart rate. Frequent eye exams are also common, and those with poorer eyesight are instructed to wear glasses or contacts. Some may qualify for eye surgery. In more severe cases, if the extent of the condition is unknown, people may undergo a CT scan or MRI to get a better picture of how organs and tissue are being affected. Because this disorder can affect the spine, surgery to correct spine alignment may be required if the spine is curved too much. Also, stents may be placed in the arteries of the heart to open up any narrow arteries. In some cases, the teeth may be affected by Marfan syndrome and may require dental surgery or treatment. Physiotherapy is also recommended if people suffer from joint pain, and sometimes pain medications are administered as well. I hope this gave you some more information and insight about Marfan syndrome. Here are some additional resources and references in case you were interested. Thank you for watching.